Welcome to this Theater J podcast video call moment, talking about One Jewish Boy, our production running from June 7th through July 2nd. My name is Jacob Ettkin. I'm the Arts Outreach Coordinator for Theater J, and I'm joined here today by Brooke Bralove, who is a Bethesda, Maryland-based psychotherapist who specifically practices ART, which stands for, I believe, and correct me if I am wrong, Advanced Resolution
Accelerated
Therapy?
Resolution.
Accelerated. Apologies. Accelerated Resolution Therapy. And yeah, we're here to talk about all things One Jewish Boy, all things trauma, all things healing, and the various many pathways to healing. So thank you for sitting down and being willing to chat. It is beyond appreciated.
Yeah, thanks, Jacob. Happy to be here.
Yeah. So for reference, opening night, when Brooke and I first saw the play, was this past Monday. It's about a week later, so you've had some time to sit and simmer and process and think through, what might be some of the core takeaways that you got from this piece of theater, specifically in relationship to your work.
Mm-hmm. Yeah, so I think, first of all, the play is extraordinary. I mean, I think that it does a really great job of giving the feel of trauma, and the kind of lasting impacts of trauma on relationships, on people's psyches. And it just does a wonderful job. And it is also exquisitely acted. And I just want to say that the two performances are really unbelievable. And the length of time that they are both on stage with no break, and that they're just really exquisite performances. So I want to say that off the top. And I think this play is really important in a number of ways, and again brings up themes. Obviously, the theme of trauma as a whole. It also brings up sort of you see the, again, lasting impact of the trauma, and in this case PTSD, although PTSD does not always stem from trauma automatically, but it often does. And again, PTSD is post-traumatic stress disorder. And I think it also brings up issues of intersectionality. We've got religion, we've got race, we've got gender, all kind of weaving their way through this play. And the complexity of that between these two individuals trying to be in a romantic relationship. And two other things that I think are important. I actually think the role of empathy is very important. And, I really believe that many problems in the world would be solved by real empathy, and, both felt and demonstrated. And I think there is a complete breakdown of empathy in this couple, which leads to a lot of challenges. The last thing, of course, is related to trauma, but it really is this idea of intergenerational trauma. And so those are the themes that I've sort of taken away as I've been sitting with the play in my mind for the past week.
Fantastic. Something that comes to my mind, I know, I feel like the word trauma itself is very much kind of in vogue in this current cultural moment, and I think a lot of really healthy and productive ways of I think over the pandemic, a greater reliance on people seeking mental health treatment and resources, gaining more of a vocabulary for what their experiences might be and how that's affecting them. But also, as the word specifically trauma kind of becomes used more frequently in common parlance, I think its definition can get a bit blurred. So I was wondering if you could give us that good DSM diagnostic definition.
Mm-hmm. Yeah. So again, a more formal definition, because I do think that can be helpful, is so trauma results from exposure to an incident or a series of events that are emotionally disturbing or life-threatening to the individual, with lasting adverse effects on the individual's functioning and mental, physical, and social, emotional well-being. So it is less important what the actual event is uh, than the importance of how the individual is impacted by it.
Mm.
So, what I often tell people is what is traumatic for you may not be traumatic for me, and vice versa. And so, I think we have to be careful when we start judging trauma. And a lot of what happens in this play is around comparison of suffering, which is a dead end, and yet it is almost addictive to many of us to do. But what I often say is it's really trauma. Again, that's more of the formal, definition, but one step sort of below that is whatever happens that causes someone to be extremely overwhelmed and not feel that they can navigate a situation. So if I'm in a car accident, but I'm not overwhelmed and I'm able to stay extremely calm and clearly I don't get hurt, things like that, then that wasn't traumatic for me. Whereas a similar kind of accident with the same outcome for someone else could be very traumatic. They might feel extremely overwhelmed and then have lots of, sort of symptoms afterward. So I think, again, less about what the incident actually is and more about how it impacts individuals, which is different.
Yeah, no, and I love that framework as I think that ties in so kind of beautifully to the note on empathy that you gave earlier of it's again, everyone processes their own experiences individually. And also it is so important to extend that level of empathy and that grace. And trying to imagine a brain other than your own, trying to live through that experience.
Right.
And yeah, the trauma Olympics of this play are I know I see it, or when I remember seeing it, I remember being struck by like, in a weird way, it's trying to like bond with another person by sharing your own experiences and like trying to commiserate in them, but in interesting ways that sometimes happens and sometimes they wedge them further apart and it's messy and complicated. Um, which, hey, that's what you want to see in a good drama, I guess,
Yeah.
messy and complicated.
Yeah.
Um,
Yeah. But I think
but
you raise an important point, which is that I think we often share traumatic experiences with people with the goal of becoming closer. But as you said, it doesn't always go that way. And when there is some sort of competition or a sense of I have it worse than you, and when someone is kind of wedded to that story, my trauma is worse than anyone's, or my trauma is worse than yours, you're rarely going to see people make a greater connection, and you're often going to see them be driven further and further apart because they aren't willing to get out of their corner and go visit the other person in theirs. And if you do that, usually people start inching their way toward the center. And that does not necessarily happen very well with this particular couple in this play. And in some ways, it's sort of hard to watch as a therapist because I could think of many ways that each of them could have said one sentence that would have allowed for a
mm,
greater connection and to build a bridge, and they really don't know how to do that very well.
yeah, I think that is astutely put, and also kind of I think it speaks to the credit of the language that the playwright is choosing. Of it is very intentional. Of yeah, there are so many moments where with just a shift of a phrase, is something that divides bridges instead. Um, and I think that yeah, that kind of that comparison of trauma and comparison of suffering, I
Mhm.
think is interesting in this play, and I wanted to get your thoughts on specifically like this play also throws in that like meshes that conversation with conversations around intersectionality and conversations around identity politics.
Mhm.
Um, and how that even like, again, trying to have these broad categorizations of experiences to help people maybe share in their experiences versus the hyper individualized look and empathy of that all is messy. And I wanted to see, yeah, if there any moments in the story where you saw, yeah, the trauma comparison and suffering, the intersectionality of it all, these conversations meshing together.
Yeah, I mean, I think there are times in it where I think that I was struck by the way each of them actually uses statistics at different points. So in the beginning of the play, Jesse's using statistics around anti-Semitic violence. And at the end of the play, Alex is using statistics around maternal infant mortality rate among Black women. And you can see that they are very invested in getting a point across. And yet the other person really is dismissive. And so nothing happens from that. There's no, wow, that's higher than I thought, or oh my God, I can't believe it's grown so much, or anything like that. It's just a complete miss. So I think that, Jesse takes up a lot of space with his trauma in the play. And I think we only really start to know more about her trauma really at the end, almost when, I think she is pretty exasperated with him. And her traumas begin to kind of, she needs to talk about them. And so she brings up gender and race, and he's very dismissive of and in denial really about his own racism, which again, if you can't look at your own isms, it's very difficult to connect with someone who may not look like you or be from a similar place in the world if you aren't willing to at least be curious about it. And I think that's what came out of, one of the things I say in therapy a lot to people is, more curiosity, less judgment. And so if they each brought more curiosity about themselves and the other by asking more questions, or tell me more about that, or I don't understand that. Can you say more? I mean, again, I know I'm talking like a therapist, which is probably pretty annoying, but some of these phrases are there for a reason. They really do build bridges. But there's so much judgment of you're overreacting, you're underreacting. And so I think that the piece that I feel is so important is to look at when someone is stuck and that the trauma becomes their entire lens, the other person in the relationship feels that they have to go to the complete extreme the other way, which is this is no big deal and you should get over it. Why haven't you gotten over it? And so this is how we get, again, these corners. This is why people stay in their corners. And one of the things I kept thinking about is, get this man to a good therapist. I don't think, I think it's clear that he didn't get any therapy, or maybe a little bit.
Yeah, I remember that ties in kind of beautifully to what I wanted to ask about next is I remember one of the moments that stood out to my brain while watching this play is, yeah, there's a moment where I think he says he started going to therapy again. And is specifically given a potential PTSD diagnosis.
Right.
Which I'd love if you could kind of elaborate what exactly, again, that's another phrase that I feel like is somewhat in common vernacular. Again, people have a vague idea of what that means, but what are the symptoms of that? What does that actually look like in a person? And so it's a PTSD diagnosis and potentially a conversation beginning around inherited or intergenerational trauma,
Right.
specifically for him with his anti-Semitic hate crime experience.
Yes.
So yeah, I'd love to hear more about, what exactly is PTSD?
Sure. Yeah, and then I can
And
go into
then,
more about that.
yeah.
So again, it's post-traumatic stress disorder. So it really is after someone experiences a trauma, do they develop mental health issues as a result of that? So it could be that they get very depressed, very anxious, panic attacks, um, sudden like reactions to noises, which we see a lot in the play. But basically, it's behavior that is sort of maladaptive post trauma, which indicates really social and emotional distress, really. Um, and there are varying degrees of PTSD. Um, this is a diagnosis that I almost feel is probably underused. And what I
Hmm.
mean by that is that I think we recognize depression, we recognize anxiety, and psychiatrists recognize those immediately. But we don't often do the work to find out what is the depression and anxiety related to. And so, in my opinion, it's a bit underused, underdiagnosed, um, because not all the time, but it's just my sense of it, really. Um, but I do want to kind of talk about, the ways it manifested in the play, which I think were really interesting. Which is, you see Jesse throughout have very strong body reactions to things. Um, so he, it seems, from what we get to see is that he's having panic attacks. He's clearly sweating at different times. You can tell he's putting on a tie and feels like he's choking. So the triggers there's lights, bright lights trigger him. A baby crying triggers him. Sirens, again, putting on something that's too tight. And you just can see the suffering. Um, and so PTSD really shows up in the body. Trauma shows
Hmm.
up in the body. There's a very famous book on trauma called The Body Keeps the
Body, the
Score.
score. Yeah.
Yeah, nodding knowingly. And it really is this idea that the body holds on to trauma. And that's part of what I wanted to talk about here is that you clearly see that whatever therapy he's had thus far, and then he, is, I guess, starting up again, maybe, hasn't really been transformative. I'm not saying it
Hmm.
hasn't helped. It may have helped, but it has not transformed this into what we hope, which is post-traumatic growth, which is really um, going through some sort of trauma and using it to grow in ways and learn things about yourself to empower yourself to move forward beyond it. Um, and this is where I think it's important to understand that there are limitations to talk therapy. So I am a talk therapist. I've been in private practice 19 years. I talk. My patients talk. That is what we do. If it is silent the entire time, it wouldn't go very well. And yet, as I've been doing this longer, I've been exposed to other types of modalities, and I have become really just a firm believer in some of the body and brain based modalities. So I am trained in accelerated resolution therapy or art therapy, which is a treatment that uses bilateral brain stimulation to change the way the brain stores distressing images and sensations. So through bilateral eye movements, literally eye movements back and forth, while you're processing, there you go, while you're processing a trauma, um, we do that. And then we ask the person to voluntarily replace those images with images that they want to hold on to. And then we store those in the brain. It is highly, highly effective for trauma, PTSD, and about every other mental health issue possible. But it's really the idea that not talking about it, but having someone hold an image while they're in distress, and then having that distress go down so that they can choose a positive image to hold on to. So I think there are limitations of talk therapy. And again, art is not the only therapy. EMDR, which is more well known than art, but it's very similar. Eye movement desensitization reprocessing. There's also somatic therapies, which are body-based therapies, somatic experiencing. And I really encourage people, if they know someone who's struggling with trauma, if they themselves are stuck, to experiment with some of these other types of modalities instead of just talking about it.
Absolutely. I mean, I remember not for trauma, but for anxiety of it all, a diagnosis of anxiety of it all. I know someone near and dear in my life started going to a therapist who practiced primarily CBT, and found out reference cognitive behavioral therapy. I love my psych degree, common and Fletch, and was not finding tons of success through a traditional kind of not talk psychotherapy, but a very conversational mode of therapy, and found a different practitioner who really focused more on DBT, dialectical behavioral therapy, and like that felt much more actionable to him and his brain, and is just, I think, a way of reassuring that like there are a million different people and a million different practices to address the issue. But it's my understanding that both EMDR and then ART off of that are somewhat new to the field. And can you talk to me a little bit more about how they've kind of emerged?
Yeah, EMDR is actually not new at all. It's been around for quite a while. ART was founded in 2008 by Lainey Rosenzweig, a therapist who went to an EMDR training and loved it, but thought she could do a little better. And so she spent all this time honing in and perfecting this wonderful protocol that we have for ART. And, again, both of them use some sort of bilateral brain stimulation. ART is a little bit different than EMDR in that it really focuses on images and sensations, whereas EMDR often focuses on core beliefs and feelings. The other piece is that ART is a more rapid treatment. It's usually 1 to 5 sessions per issue that you're coming in with, whereas EMDR can usually be more than that. And the thing about ART is that it has a resolution at the end of every session. So it has a real protocol, a cadence, and there is resolution at the end of every session, whereas EMDR can be a little bit more meandering. And again, I'm not knocking EMDR at all. It's amazing and wonderful, but it's important to kind of educate yourself about some of the differences to see what you think your brain will respond better to. And so I think, again, we just keep knowing so much more about the brain. And so all of these, I guess non-traditional modalities, I would say, are becoming more and more popular because we're just learning that the body holds the trauma on a cellular level. And even if you change some of the feelings, you cannot change your fight, flight, or freeze response. It is automatic. It's the sympathetic nervous system that gets turned on when there's a bear in the forest, which is what you want. You want to go into fight, flight, or freeze, but it means your parasympathetic nervous system just goes offline. And so, there are also lots of other types of exercises people can do whenever they're incredibly anxious or overwhelmed or stressed out that focus on the body. There's a lot of, deep breathing, meditations, body scans, vagus nerve exercises. The vagus nerve is incredibly important. And when you go into fight, flight, or freeze, your vagus nerve basically just deactivates. And then there are these simple exercises you can do to get it back online, which is the parasympathetic, part of the parasympathetic nervous system. And so there are also things I hope people have heard of: tapping, EFT, emotional freedom technique, which is different meridians you can tap on to create relief in your body. And so there's so much hope, and there are really things you can do. I mean, something as simple as humming can actually help the vagus nerve, help the parasympathetic nervous system get back online so you can get out of fight, flight, or freeze. And I always tell people, I can explain them to you, but you can literally go to YouTube now and type in vagus nerve anxiety exercises, and a bunch pop up, and you just have to kind of learn them once. And then the main thing is you have to remember to do them when you are panicked, upset, anxious, or overwhelmed. So I actually tell all my patients to write the exercises down in their phone, so that all they have to do is just look at them and read them and know, instead of trying to remember what they are in the moment when your brain's already offline.
That makes a whole world of sense. And yeah, my brain then goes to like, what a different story we would be telling if Jesse or Alex had some more coping strategies that they could use, be it breathing, be it vagus nerve exercises, et cetera, et cetera. Because I think we see in this play, we see the struggle, and we talk about help, but I don't really think we see a lot of help.
No, I mean, there's not 1 minute where if he's struggling, she says, want to sit down, or how about you take a few deep breaths? I mean, there's sort of none of that. The body is actually pretty much ignored until Alex starts talking about the Black female body toward the end, which is very interesting, and how it is neglected and overlooked. But his body gets overlooked as well.
Mm-hmm. And I think there's also something interesting, in talking about the body keeping the score, the body holding trauma in its various ways. And I think that contextualizes the fear that Jesse feels in particular throughout the play, and Alex, I think, by the end, regarding what happens with a child that they might have.
Yes.
And how if trauma is being physically held cellularly, does it have an expiration date in that way? Can it be passed down? I mean, like, there's again, more of a consciousness around the term intergenerational trauma appearing in the world. But how do we see trauma like that move, and how does trauma interact with time?
Yeah. So I'm a firm believer in intergenerational trauma, and mostly because if you read the data, I mean, it's really unbelievable that, good old mice and rats will, there's a female rat, and she learns that if I press this lever, I'm going to get shocked. And so she stops pressing it. Then she becomes pregnant. So before she's even pregnant, she has learned this. And those babies will also be adverse to, are born knowing that they should avoid that same lever. So it's really, I mean, it's absolutely fascinating, and that they weren't even created, and so it really is in their DNA, and we know this now. And I think it's also validating in terms of the question that so many people ask, how did I make the same mistake my parents made? Or how
Mm,
is it that I spent my life saying I wouldn't be abusive to my children, and yet here I am acting that same thing out, maybe less severely, but still. So I actually think it's validating in terms of what we just know and see day to day. Um, but these things are passed along. And obviously, there's the DNA part, but then there's, of course, what the stories we share and how we talk about things, right? So, racism is totally intergenerational. Um, and, the whole idea of what it means to break the cycle, there really has to be a reckoning with what the cycle is, whatever you're talking about, and a commitment to saying it stops with me. I end it.
mm,
And that takes an incredible amount of awareness and a lot of resources, I think, to figure out how to do that and what does that look like and how to get support around it. And then it means teaching something extremely different to your children and letting them know that it exists in the first place. But um, I think we very much underestimate the intergenerational trauma for African Americans in this country. I mean, completely, we do not take that into account for the actual stress that lives inside their bodies from birth all the time. I look at it, it's like a low level hum of trauma,
mm.
and their lives go on top of that, but it's always there. Um, and I certainly think you see intergenerational trauma with Holocaust survivor families. That is really felt. And anyone who grows up in a household where they're survivors knows exactly what that feels like. Esther Perel, actually, the wonderful couples therapist and sex therapist, talks about growing up in her family where her parents were Holocaust survivors, and just it was just in the air, right? This fear. And Jesse does allude to that. There, it's going to happen again. It's going to happen again, kind of feeling. They're going to come and get us, which I have heard from many Jewish patients of mine over the years. That's something that they really can't shake, this idea that it could happen again.
Yeah. And I think that is a fascinating and helpful context for the intersectional questions this play asks. Of it's not just the traumas that are passed down through Holocaust surviving families or through Black families. And that this could launch a whole other conversation about like, oh, American racism is very different than UK racism, and how this
Yes.
play is very much grounded in, okay, it's a different colonial power, and how have these dynamics evolved. But yeah, I remember you highlighted a quote from the play of an argument between the two of them. I think Jesse saying, there's scar tissue in my DNA, when talking about the anxiety around having a kid, and Alex responds, mine too.
Yeah.
Um, and how these more sociological conversations about race and about identity and narrative identity have a distinct biological component too, and how that makes it all the more complicated to try to hear each other's stories.
Yeah. Yeah.
Um, which is one of the things I remember taking away from the play the first time I read it. Of
Mhm.
these are two people who are desperately wanting to have their stories heard and think that the other should be able to hear them,
Right.
but for reasons they can't. And I wonder if that speaks true to your experience seeing the play. Um,
Mhm.
and also, yeah, if you have any thoughts on kind of that idea and the
Yeah.
struggle.
Yeah. I mean, I think, that's about as on the same page as they ever get. Mine too. You know what I mean? And and they, I even kept thinking if they could just stop talking and, again, it wouldn't maybe be the greatest dialogue, but if they stopped talking and looked at each other and held each other's hands and just breathed together, that would be confirmation of I hear you and I see you. And that just they can't quite do that. And sometimes there aren't words, and sometimes things have to be almost like consolidated in a nonverbal way. And I actually help couples do this all the time. At the beginning of a session, sometimes if they're not connected, I'll just have them turn toward each other and hold eye contact, which, by the way, is excruciating for most couples. Literally excruciating. I mean, it's really challenging. Or to have a hug that lasts, 20 to 30 seconds can be so uncomfortable because we just don't do it that way. But I do think that her belief that there should be an expiration date on his traumatic event, and her wanting to live in the present, is he's just incapable of doing that in many ways. And I think if he got the right treatment, he may have had more success with, really being able to differentiate between the past and the present. And, reminding himself when those sirens are going off, he is not there. He is not back to that night. And again, he could do things to his body in the moment, or with his body in that moment, to change his brain, which actually believes he's back in that moment.
Yeah. I think that is succinctly and beautifully put, and also reminds me of, kind of where we started this conversation around the importance of empathy, and how, if some other form of help could have been given to Jesse and he could have received it, and he could be maybe more in the present moment for some aspect of this conversation, then that just opens up the door for so much more. And for some gesture, as you said, be it verbal, be it nonverbal, be it some form of empathy and connection to begin.
Yeah, I mean, even something simple as, when she's talking about her experience being harassed by men, I thought, even if he were to say something very simple like, thank you for telling me, thank you for sharing that, which is not actually very difficult, but basically says, thank you for telling me something vulnerable, and I'm receiving that. And I don't have to do anything with it. I don't have to fix it. I don't have to make it better, because I can't, because that's your experience and your experience is valid. But I really do want to almost encourage people that there are small ways to work on these big differences, these big sort of, where we miss each other, and no, that's racism, no, that's sexism, and, which one matters more to whom, with this intersectionality. Whereas if you are a witness and you stay curious, you're much more likely to stay connected.
I think that is a lovely, lovely way to end this conversation. A call to action to anyone who may be in a similar position, to stay curious, to open arms, a call for empathy. And if you think you might be in need of help in some way, there are so many resources out there in the world. If there's any, again, you want to shout out before we end this call, feel free to do so.
Yeah, I mean, I would encourage people, obviously, in the DC, Maryland, or Virginia. I can be reached at my website, brookebralove.com. But I really encourage people to look into EMDR and accelerated resolution therapy. There are about 6,000 to 7,000 practitioners of art. And you can go to acceleratedresolutiontherapy.com and plug in your state and look for providers. And it is just an unbelievably effective and life-changing modality. And I really encourage people to check it out and for therapists to become trained in it.
Fantastic, fantastic. We are spreading the word. We're doing the good work.
Yep.
Thank you again for being willing to chat on this inaugural Theater J podcast, whatever it may be.
Yes, thanks for having me.
Absolutely. And